we will move to the second half of the panel, which is Q&A, and I will ask each one of the panelists questions that were generated either by the audience or we had them prepare ahead of time. My first question, or my first topic, is kind of extension of what you mentioned right now about innovation. Innovation in medical devices in health tech is about doing good. We are living in an era of a global pandemic, and COVID-19 has magnified and emphasized the disparity in access to healthcare. Some people are able to live healthier lives and have better access to healthcare, and others cannot, entirely due to their status and the location in which they are born and live in. Can you share with us, and I will start with Raymond, can you share with us your view on how innovations in healthcare and medtech can help rectify these inequities and ensure that all people, wherever they are, whoever they are, will be able to access quality healthcare services when they need them? We know that at least in the US market, a lot of the innovation is directed into the rich Western market, where the spending on healthcare is substantially higher than Asia and other places. But with the view of we are inventing to do good for mankind, can you share with us your opinion?
Okay, cool. So, I think also to extend what Mr. Karthik also shared earlier, right, that in fact, I mean, no matter how disruptive or how innovative the healthcare solution is, and also, regardless of whether or not government is funding or subsidizing the cost of medical services, I think patients in general, they are more often inconvenienced by the physical limitations and the accessibility issues. Therefore, we have seen a burgeoning, number of so-called a renewed model in terms of the delivery mode of the healthcare service, playing a much more important role than before, especially during this period of time, right, whereby people are scared of, stepping out of their home, or they are really too sick to walk out of their home, and therefore, the remote consultations, the telemedicine, and all this, essentially becomes a savior to many, right? And with internet, I believe people can access such services online. They can receive the professional opinions of the physicians in the comfort of their home, and of course, to many people, a peace of mind. They just want to consult for the sake of as an assurance, right? So for our case, in our company, we are basically dealing with two issues right now, right? So number one, how can we decentralize high quality medical service, especially in the suburban or even the rural areas itself, whereby the doctors are simply not well trained. Okay, so we want to, in a way, scale our AI-enabled expertise. Why? Because when we train the machines are essentially learning from the best brain specialists or the lung specialists in the top hospitals in the world itself. And instead of these people having to travel all the way physically, take a train, take a flight, having to take a queue in the city areas, can they benefit from these healthcare services in the hospital in the vicinity? The answer is yes, it can be done. So that's how when we expand our innovations, we also make sure that we also cover this part of the market itself. At the same time, we are also talking to teleradiology companies, right, to incorporate AI solutions, because the objective is that it's not about money anymore. I think a lot of teleradiology companies, they are quite well funded, but I think essentially is how to admit, how to receive or address or access more patients in the same amount of time, because essentially time is not money, but time is life.
Excellent. This is interesting, as Dr. Ibtisam mentioned before, the concept of doctor for every citizen. Now, with your technology, it can be augmented by AI to reduce backlog and to increase accessibility. Dr. Tan, what is your view on this topic?
So I of course agree with what Raymond said. I think accessibility to healthcare, to medicine in general, poses quite a lot of challenges. So at least in my opinion, there are two that I think is most concerning. So there are two factors. The first is distance to the healthcare. The second one is cost of acquiring this healthcare. So both contribute to reducing the accessibility to a big population in parts of the world. Just for example, distance. I think just to say, if there are silver linings to the COVID-19 pandemic, that is one of it will be it has accelerated a lot in remote healthcare. Not only just telemedicine, but also devices that people can bring home healthcare to plug into the gaps of telemedicine and remote health. So that brings a higher level, higher quality of healthcare to the homes of people. But of course, we still do understand that some of this technology requires internet connection and things like that. But it takes time, you know. We are getting there. So we're trying to shorten the distance from individuals to the accessibility to access to healthcare. Not necessarily. I mean, there are conditions you definitely need to rush to the clinic or to the hospital. But what's before, you know, you can part of managing the health problem can be done at home. And right now, this is not possible because a lot of this, up and coming innovations, the wearables, the home healthcare devices. Yes, the idea is out there, they are out there, but either they are too expensive or they are not that market ready yet. So that's distance, and cost is the other thing. I do see a lot of innovation that comes. They're just, although they are new and they're supposed to address problem of accessibility to healthcare, but they're still priced out of reach of many. So I think one, or at least my company goal, is to make technology accessible enough, a low price enough, even if an individual couldn't afford it, it is affordable for governments or for charitable organizations to provide these services to each and every individual family or things like that. So I think one good example will be in Singapore. Some organizations in Singapore are distributing pulse oximeters to everyone. Before this happened, I think most Singaporeans wouldn't bother having a pulse oximeter at home. But this is one, oxygen saturation is one of the critical indicators of deteriorating medical symptoms for doctors when they're in hospitals or in the clinic. But previously these things are really expensive. But why would organizations be able to provide them now? Because if you go onto some of the distribution websites, you can find high quality pulse oximetry at $6 or even less. So one of these things is how do we lower the cost of our innovation? Not how we make this innovation, but the cost of our product. One thing personally, I really felt that my company, Core Technology, has been around for close to 10 years. But it was only in 2017, 2018 that we think cost of the hardware is low enough and is advanced enough for us to make it a feasible product. And that's when we started. So hopefully we move towards this direction in the next decade, and maybe shorter term in the next couple of years, as higher computing power become available at a much lower cost. That there will be an emergence of wearables and home healthcare devices that can bridge this gap and bring healthcare closer to those who don't have access to at this moment. At least that's what I hope right now. Yeah.
Absolutely agree, and I think that innovation in the value segment is the most important and also the most difficult. A previous generation of innovator was focused on producing the best devices to improve healthcare without cost consideration. Our current generation has to consider cost as another part of the innovation, which makes it really hard. Mr. Karthik, maybe you can share with us your view on how we remove these inequalities and have healthcare accessible to more and more people.
Yeah, I think I have quite a few points which I wanted to share, but foremost is that I want everyone and anyone who's thinking of innovation to move away from radical, revolutionary, once in 4 or 5 decades kind of innovation. How often are we going to get a Google coming back and starting something new, or iPhone, for example, or another company like Apple? Steve Jobs did that twice in his career, once with the Mac and then with the iPhone. I haven't come across any such inventor yet. So my focus always has been, let's look at innovation that we can do every day incrementally in our own way. So when you look at that, a few things come up. For example, AI seems to be a very frequently spoken of subject, right? I was reading somewhere the other day that if I were to classify AI as an industry in 10 to 15 years from now, it will be bigger than what we know as the IT services industry today. That industry today is worth, I think, some 200 or 300 billion dollars or something like that. So AI will outpace that, which means we have to look at AI in everything we do. It cannot be that I'm dumb for 19 hours a day and about 5 or 6 hours a day I'm going to be very intelligent. That's what it means if you say I'm going to set up an AI solution or an AI department, or an something that only does AI or is intelligent only for a certain period of time. We have to be intelligent throughout. When you look at that, the definition of innovation changes. So we came across a lot of ideas, but our AI team that looks at and sieves through all these ideas is going through some. But I just wanted to bring one point. Let's assume that there is an increased chance of, in Singapore, we get rains 4 or 5 days and at a stretch sometime, right? So what that means is there will be people who will get triggered with, Dr. Tan might be more interested in this, asthma, for example, right? So can I take the weather patterns, correlate it with asthma, and then say, in those pharmacies in that area, can I stock up something ahead of time? We do get weather reports 1 week, 10 days in advance. So this is a kind of innovation. You can collect the big dots and see what you can do with it. So AI can become predictive, not only looking at what, for example, what we've already delivered. If you give me 100 x-rays, I can tell you the AI can look at it and say the top 5 are abnormal and therefore they must be attended to first. And I can probably bring forward the diagnosis or the curative process a little earlier. But think of AI by connecting a lot of seemingly unrelated dots. That's one. The second,
I think that, thank you, Mr. Karthik. I think that I want to squeeze another question. We have another 10 minutes and I have another important question for all of you. And it seems that our panel agrees that two things need to happen. One, AI need to be anywhere and everywhere in healthcare. And two, the devices that the AI controls or interpret should be more efficient and more cost effective. So that's my conclusion. I would like to bring the discussion in the 10 minutes that we have to what we heard from the UAE officials. We heard the fascinating thing. We heard that in Abu Dhabi, Audio rolled out an innovation program which will provide a stunning amount of close to over $500 million of rebate and grants to foreign companies to support their growth. We heard that in Dubai, the Dubai government established the Dubai Healthcare City, which is, and it's amazing for me, is the world's largest medical free zone. I wish we had it in California. And this is providing all-inclusive business setup, including maintaining 100% ownership. Fascinating opportunities, and I would like to bring it back to you and each one of you, and we'll start with you, Raymond, but each one of you, what was the pull factor that first attracted you to expand to the UAE? It's not an obvious decision, but you still did it. And the other one, is there any crucial advice that you can share with our audience as a prospective partners that will come to the UAE? We have only 10 minutes left. I would like each one of you to maybe do 2 or 3 minutes.
Okay, then. Okay. So yeah, and definitely, I think the aspiration of UAE, the government as a whole, to position UAE as a medical hub really speaks volume in terms of how visionary and how ambitious they want us to be, and that really excited us in the beginning. But really, in terms of the market itself, we're talking about $1 billion market in UAE. We are seeing that within GCC and UAE in particular, right, the government, not just the authorities, but the government-funded hospitals and private hospitals, they have already started to study and to accept digital health and health tech applications, and this has really become the next norm. Just now I think earlier speakers talk about home care monitoring, AI as an assistive tool itself. So essentially we are seeing a burgeoning market ready from the top and from the bottom, from the market to the authorities itself. It's a very nice ecosystem itself. A very important part is the recognition of Singapore brand value, right? And we also realize that professionally, I think between UAE or GCC as a whole and Singapore, the medical arena itself, there's a lot of a healthy, constructive exchange and collaborations all along, right? So we want us to ride on this bandwagon. Take for example, for us as a medical device company, it's important for us to obtain a medical device certification. So when we start to before we expand into UAE, we realize that Singapore HSA has a very strong bearing in terms of the acceptance by the doctors within UAE, right? So that's when we also ride on this bandwagon. So when it comes to what can be done, especially for young upstarts like us, right? Because we don't have a lot of money to burn, so it's very important that we dream big, but we start small and then we scale fast. And therefore, before we channel ample resources into new markets, it would be prudent to do a deep stick analysis of the market. So that's when we have a good start, because we already get in touch with the Enterprise Singapore, the UAE Business Council, to accelerate our initial market sensing. And that through this profiling, through these relationships that they have to connect us with, it really helps us to iterate our business model at an early stage, and that helps us to scale faster than without this catalyst. Yeah.
Excellent. Thank you, Raymond. Dr. Tan, in 2 sentences, what was the pull factor to go to UAE, and what's the best advice you can offer the audience?
Okay, so my partners and I see firsthand what the Dubai city looked like, and the openness to innovation, not only by the government, the agency, the hospital, but also by the individual doctors, and the enthusiasm into moving to the next stage of medicine, complemented by technology. So that is one, at least maybe I'm the CTO, that's one of the most important pull factors for me. And what I think is one of the most important thing, crucial step before going to the UAE as a market, is to really put your boots on the ground and take a look and talk to people and see how it works. It's, especially for Singapore company, it's a little bit different, but it is as exciting, and that actually helped us a lot when we look for partners and for us to decide what would be the most likely strategy to enter in the market. So put a foot down in UAE. Yeah.
Excellent advice, Mr. Karthik. I'll give you the full 3 minutes left.
Thank you so much. I think for me, foremost would be the fact that Dubai is a regional hub. There is connectivity. For us, we look at healthcare as being directly proportional to the number of people in a country. So by that yardstick, GCC, the biggest market would be Saudi Arabia. And to find people in Saudi Arabia, setting them up and doing projects there was going to be very tough for us. But when we set that up in Dubai, it was very easy. Setting up an entity in Dubai, for example, was a breeze. The same thing, even after about 15 or 18 months for us, was not easy in Saudi Arabia in those days. So I think that was one reason why we obviously chose Dubai. Very friendly policies to business and connectivity to Saudi and also to Africa, which is a key market for us. Lastly, any implementation we do in UAE, everyone looks up to UAE and Dubai in specific in our industry. So I think that's an obvious conclusion there.
So we are hearing, to summarize, we're hearing that everybody had a very warm welcome. It's a hyper-connected region. The market is large and a lot of support from the government.
Yeah.
Thank you very much to all of you, and I would like to give the stage back to our chairman, Dr. Shagar. Thanks all the panelists. Appreciate your time and your wisdom.
Thank you, Dr. Aitan. Excellent moderator. Thank you.
Thank you.
Thank you.